The staff came to get me because, they just didn't know what to do. She was so emotionally distraught. She had some pretty traumatic experiences in her childhood, and she had been to see lots of psychiatrists and psychologists. After that third time, she said, "I can't believe how well this is working for me." She actually said this that struck me. She said, "If this is how normal people feel every day, I can't believe I've been missing out all this time."
Hey everybody, Carl Rothschild here. I have Brian Bristol here. He's out here in California along with me, and he's a nurse practitioner, and he has one of our beds. And I'd heard such nice things about some of the successes he was having. I asked him to allow me to interview him. So first of all, how are you doing, Brian?
I'm good, thank you. How are you?
I just wanted to go over some of the successes that you've experienced and talk to you, about, and I had told you before that I'd like to also interview those individuals as well, but can you kind of just review with us what your experience? First of all, how long have you had the equipment?
I got the bed in the latter half of December of 22. So it's been, I guess, about 6 months.
Yeah, you've had it for half a year. And with that said, so what are some of the things that you've noticed since you've had it over these last 6 months?
Well, I think one of the first things, most exciting things is my patient with MS. We started out actually doing ozone therapy, and we did one session of ozone, and I introduced him to the bed. Once he was introduced to the bed, he absolutely loves the bed. He comes twice a week, and it's simple enough for him to operate. He gets in it, he turns it on, he does it all himself. Does the bed followed by the vibrogenics, and everyone has had the same experience of just the way they feel so good after getting out of the bed. But for him, it's the beauty of his story is that he's been consistent with it, and I think it was about 3 weeks ago he had an MRI done, and the neurologist was telling him how there's no new lesions. The exact term he used was there was no activity, and that he told him, continue with your medications. Everything seems to be working fine. He says, "Well, I haven't been taking the medications." And he told him what he was doing, and he said, neurologist said, "Well, I don't know anything about that, but keep doing it because it's working." So that's a big success that I really love.
This patient that had MS, what was their symptoms at their worst?
At the worst, he said that he had pain, generally in his lower extremities. He had pain. He would also experience some tingling sensations in the lower extremities. He also would have these breakouts along parts of his body, and he said they would show up, and then usually they would last a day or two, go away, and then pop up again. And he said it was a constant thing. He did say that, and he would have, his energy would be low. He would feel like at times that he just couldn't function.
Then soon after he started with the bed, I'm assuming based on what you said that he was doing much better then, right?
Yes, yeah. He said that he told me, he said, I don't know. He's like, I know I can't afford this, but he said, I feel like I need to do this because it's had an immediate impact on me. It's had a difference that I can feel, that I don't want to stop this. So he's been using it and he loves it. Just last week, I met a woman. I had a patient come in. She was she came in for a retesting of an STD, but she was so emotionally distraught. The staff came to get me because, they just didn't know what to do. And in talking to her and allowing her to talk and listening to her, she had some pretty traumatic experiences in her childhood. And she had been to see lots of psychiatrists and psychologists and was actively seeking a psychiatrist when I saw her last week. She said she's been diagnosed with everything under the sun. And so at one point I just said, let's try the light bed. And I took her back there, introduced her to it, and she was a little apprehensive, but she said, I've tried everything, so, why won't I try this? And we put her in the bed. And then after she got out of the bed and I was talking to her while I was setting up the vibrogenics, she said, well, at least I can say I feel calmer now. After that first session, she said, I'm feeling a little better. At least, we'll come back and we'll do this again. And I had her come back the very next day, which was a Saturday. She looked different than she did the first day. She looked a little more, upbeat, and she looked a little more neater and she looked like she was in a better place. And then we did again the light bed and I had her come back on Monday. And when she came back on Monday, her hair was down, her skin was beautiful. She was dressed in, she was well dressed. She looked like a different person. She looked great. The third time, after that third time, she said, I can't believe how well this is working for me. She said, I told my friends, I was talking to my friends and my friends were like, what's going on with you? You're like so different. And she said, she actually said this that struck me. She said, if this is how normal people feel every day, then I can't believe I've been missing out all this time. Something to that effect, she said. But it struck me because, the way she said, this must be how normal people feel. And I was pleasantly surprised because, in all honesty, I put her in the bed because I didn't quite know what else to do with her. I knew medication wasn't going to be the answer because she's been doing that.
Brian, I had heard that you had a gentleman, his name is Steve, that had a bunch of issues like Alzheimer's and dementia. And you were indicating that he was having a great experience with it. Could you kind of elaborate on that?
Well, essentially, his wife was his caregiver, and she would take him around. And she warned me going in. She had come out and she said, he's terrible. He doesn't like, seeing doctors or whatever. He's here. The reason we're here is because he's having this incredible back pain he's complaining about. But, she's like, just be mindful. He could be belligerent. He may not be very nice to you. But I went in the room and I told her she'd already been taking medications and all this sort of stuff. And I said, well, let's try the light bed. And I put him in there and he got out of the bed and he said, he touched my face and he said, I like you. He's like, you're the first person that has, that seems to really care about me and care about doing something for me. He said, and I asked him what it was like in the bed. And he said, I almost fell asleep. He said, it was so relaxing and I feel good. And he's like, when can I do this again? And the wife told me afterwards, she said, well, I'm really shocked that, the way you two got along. And she said, and I'm really shocked that he wants to come back because he doesn't like to go anywhere. And she said it was a struggle to even get him out of the house to come. but he knew he was coming to get something for his back. And she said, and the fact that you didn't give him any medication, and he feels good, she said, we'll be back. We did, I think it was 4 sessions. In all honesty, I don't know where he's at now, but every time he always looked forward to coming in, getting in the bed. And every time he left, he said, he felt great. And I mean, the last time I saw him, he told me he loved me. So, don't know how much of that is the dementia, but he's a very sincere guy.
So Brian, thank you so much for sharing this information, and I hope to hear from you again soon with some more of your wonderful experiences, okay?
My pleasure. Anytime, Carl.